Welcome back to Drug Talk, everybody. In today's video, I want to quickly go over 3 things you should be aware of before using Paxil or Paroxetine. Number 1. Antidepressants like Paxil take some time to work. They don't work overnight. As a rule of thumb, you should notice some resolution of your symptoms of depression within 1 to 2 weeks, but it could take 4 to 6 weeks or sometimes even longer to realize maximum benefit of the medication. For this reason, it's important to try not to give up on the medication in the early phase of therapy. Try to give it 1 or 2 months before you decide whether or not this is the right medication for you. Having said this though, some patients will unfortunately need to stop the medication early due to side effects. Some side effects that may cause patients to stop using Paxil early may be anxiety or a worsening of depression. Number 2. One negative thing about Paxil is that it may cause sexual side effects. There are numerous sexual side effects that can be caused by this medication. Abnormal ejaculation may occur in 13 to 28% of patients. 2 to 10% of male patients may experience erectile dysfunction. 2 to 10% of patients may experience an orgasm disorder. And reduced libido or sex drive can happen up to 15% of the time. Many patients find that these side effects go away over time, but for some patients they persist and may cause the patient to discontinue Paxil. Fortunately, if sexual side effects are a concern for you, there are other antidepressants that report sexual side effects at a lower frequency and others that don't report sexual side effects at all. Before we talk about the third thing you should know, I want to quickly take 5 seconds to let you know that you can pick up a copy of my new book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. And number 3, after taking Paxil, you may find it more difficult to sleep. In terms of percentages, insomnia seems to happen between 7 and 24% of the time in patients using Paxil. This is a common side effect for medications in the class of SSRIs, or selective serotonin reuptake inhibitors, although they cause insomnia at different rates. One trick that can help decrease insomnia associated with Paxil is to take your dose early in the morning. Some patients have also reported that decreasing their dose has also helped with their insomnia. Having said this though, be sure to talk to your doctor before making any dose changes. And a third option would be to talk to your doctor about prescribing something that can help with sleep. And that's all we're going to cover today. Take care.